Many Kenyans know little to less about thyroid disease that is currently affecting an estimate of thousands across the country. With the Thyroid Awareness Month in May, patients living with the disease have shared their struggle with the condition and are calling for more awareness. Melissa Oduor narrates the struggles of thyroid disease. This story was produced by Eunice Minor. Take a look.
There's this disease, I've never heard of it, never. I don't know what this is, and I think, oh, it will be gone after 3 months, that's fine.
Thyroid disease patients do not have the same level of energy as that of a normal person.
You are tired, you do not sleep well because your body is always working.
According to the World Health Organization, diseases of the thyroid gland are among the most abundant endocrine disorders worldwide, second only to diabetes. The prevalence ratio of men to women is 1 to 10, meaning more women are likely to get the disease than men. The thyroid is a small butterfly-shaped gland in the front of the neck. It produces a hormone that controls virtually every organ system in the body.
That produces the hormones we call thyroxine. These are hormones made using iodine. You all have heard of iodine that is in our salt. This hormone works in very many ways in all aspects of the human body. It helps in metabolism or gives your body heat. It makes your heart beat in an even rhythm. Thyroxine itself is a hormone that's required for living. Without it, somehow it's going to happen, you will not live for long.
There are two main types of thyroid disease, hyperthyroidism and hypothyroidism, that can affect anyone across all ages. Sarah Katule, a mother of one, was diagnosed with hyperthyroidism in 2011 following the birth of her now 10-year-old daughter.
Taking her to the clinic because of the symptoms, I passed out on my way to the clinic. And then after that, I had gone to see the doctor quite a number of times, and they were not able to diagnose what was going on with me. After that is when he was able to diagnose me with hyperthyroidism.
Dr. Paul Ngugi is an endocrinologist or thyroid specialist in Nairobi. He says hyperthyroidism occurs when the body makes too much thyroid hormone.
And the thyroid gland or thyroxine overproduction goes in various ways. First, there is what we call, in our language, autoimmune diseases. And the autoimmune diseases means that your body develops antibodies. Now, in Graves' disease, the antibody stimulates the thyroid gland to overproduce. In this situation, patients get very hot. They are not able to tolerate heat. The heart beats very fast. They are restless, and their eyes pop out. We have seen people with eyes that have popped out, a very serious complication of thyroid disease.
If you look at one of my eyes, one of them is bulged out. It started swelling.
Hyperthyroidism symptoms can be discomforting, disabling, or even life-threatening.
I would eat, go to the washroom, remove it, come back, feel hungry again, and eat and go to the washroom. My skin became really pale and dull, and I had this, they call heart palpitations, or where your heart is beating really fast. I was sweating, I was shaking, I was having anxiety, too emotional.
You do not sleep well because your body is always working. And even if you sleep, you wake up very tired.
Hypothyroidism, or an underactive thyroid, occurs when the thyroid gland creates less than the normal amount of thyroid hormone.
And how does it go down? One, you may have been operated and the thyroid gland was removed completely in adventure. Two, the thyroid may have been maybe a cancerous growth in the thyroid. And hypo can also come from, again, antibodies. Instead of stimulating, this time they destroy the thyroid gland. And this comes over time. And there are diseases that maybe your viewers may have heard of, called Hashimoto's, thyroiditis, where the autoimmune reaction destroys the thyroid gland. Hashimoto, if you see it in good time, you want to control the antibodies. So you give drugs like steroids and other drugs that control immune reaction.
Jackie Gashoka, who is in her 30s, has been living with hypothyroidism for the last 7 years.
My son was born in 2014, October, and then The next year, which was 2015, around March, I started noticing changes with my body. I remember I was around 55, and in a span of, I think, 3-4 months, I gained 10 kilos to 65. I did approach an endocrinologist, and the first thing they did was to check my antibodies. So my hypothyroidism was connected to the Hashimoto's.
This one's gain weight, start gaining weight. But the most significantly, they are intolerant to cold. So when everybody else is wanting to say, open the windows, they want to close the windows and they want extra blankets. And the gain weight comes with edema, and they slow down. They are groggy, they sleep a lot, they will have poor memory. This one, the heart rate goes down. It goes down to below 50, and eventually they get into what is called mixed edematous coma. They'll be swollen, puffed up with fluid all over, and they can get into coma when it has not been treated for some time.
Hyperthyroidism and hypothyroidism occurs when the thyroid gland fails to function normally, and the doctor's goal is to return the thyroid hormone levels back to normal. The treatment depends on the cause of the patient's thyroid condition.
To treat hypo is very easy, unless the patient comes in coma, because you're giving thyroxine. So it's just 1 tablet a day, or 1 tablet and a half, or 2 tablets. But it's what viewers should know is that these drugs are taken throughout your lifetime. It's not taken 1 week, because it has very few symptoms, and people have this tendency of taking it for 1 month or 2 months when they're feeling all the good and they're told their results are normal, they stop. That's not very wise, because you get complications from the thyroid slowly. And by the time you get sick again, so that you go to the doctor, your heart is damaged and you are in a lot of trouble.
My medication has remained the same all through. For the 7 years, I've been on 50 mcg.
Hyperthyroidism, also known as overactive thyroid, has 3 main treatment options, and removing the thyroid through surgery is one of the options.
Most people will get their disease remission or the disease going down maybe in 2 years' time. So we are going to take your medicine for the 2 years. And you have to have it checked. The doctor will regulate your dosage of drugs as you go on until he's able to withdraw it.
Sometimes the drug options may fail, and the doctor may opt for surgery.
The doctor that's what is called subtotal thyroidectomy. That means they remove a portion of the thyroid gland and leave a small portion to satisfy your needs for thyroxine. It's important that I underline here, this surgery cannot be rushed. That means the heart rate has been controlled well, and the thyroid levels have also come down appreciably. People have died on the table, so it's risky to go to theater when you're not ready.
He did a partial surgery. He removed half of the part that was swollen and then left the other one for my body to use, and now I'm okay.
Radioactive iodine is another option when the patient is given radioactive iodine to destroy the thyroid gland completely.
When it destroys completely, that means you'll come from hyper and then you go to hypo. This process takes like maybe 10 years, sometimes 20 years. Now when you reach hypo, then you have to take thyroxine now for life.
Living with the thyroid disease comes with its own share of challenges, and according to Sarah and Jackie, more needs to be done.
Every country has its own challenges. Yeah, here in Africa, it is affordability. The cost of treatment, from diagnosis to doing the tests, it is also the lack and the shortage of thyroid specialists or endocrinologists. Most of them are densely populated here in Nairobi. We have patients that have to plan every month to come to Nairobi just to find specialized quality treatment. And I'm like, that shouldn't be happening.
Probably what the Kenyan government or the insurance companies can look into is to helping into at least covering some of these tests that are done, or a consultation or two that could really help people who are suffering with it.
There's public awareness that's important, but also for doctors to be vigilant in testing. You test more often, then you're likely to save a life or improve the quality of life of an individual.
Having a support system goes a long way in dealing with thyroid disease. Sarah Katule is passionate about sending the message that anyone living with thyroid disease is not alone. In 2017, she founded a support group known as the Thyroid Disease Awareness Kenya Foundation, TDAC, whose main purpose is to help create more awareness on thyroid disease.
We create thyroid disease awareness. We empower patients with information that is thyroid related so that they can know where to begin.
So the TDAC group is a safe space for us. We are able to talk. We're able to go into the deep matters that people don't talk about, especially infertility. And so that's a safe space where we get to talk to each other, encourage each other.
There is need to create more awareness on thyroid disease here in Kenya, and according to Dr. Ngugi, if thyroid disease is diagnosed early enough, it will help boost the chances of effective treatment.
We like people to diagnose the diseases pretty early. Where there is family history, I think you need to be routinely vigilant.
The good news is that the thyroid hormone abnormalities can be managed.
The checkup is important. Even if it's not every month, maybe twice a year or even once a year, but at least do it.
With us, we are on medication for a lifetime, but it's not that it's that bad once you know how to manage it. I'm living a normal life right now.
For now, there is no specific data on how many Kenyans are living with the disease, even as calls for more awareness by the Ministry of Health continue to rise. Reporting for Hope TV News Watch, I'm Melissa Odor.